Hi, this is Dr. David Macias. I'm an orthopedic foot and ankle surgeon here at OrthoVirginia. I'm going to talk a little bit today about flat foot deformity. Flat foot deformity I put into two very large groups, either a deformity that someone has had their entire life or deformity that someone has developed later on in life. For someone who has had a deformity of a flat foot for their entire life, it is not necessarily painful, and I will often see young patients who come in just to have their feet checked out because they have this deformity. If they have no pain and they have full function, then I do not recommend any treatment outside of accommodative shoes. For patients who have developed flat feet later on in life, it is almost always associated with pain, unfortunately, and this is because there's degeneration of a tendon on the inside part of the ankle called the posterior tibial tendon. Now, for patients who either have a painful flat foot that they've had their entire life or patients who have had a flat foot that they develop later on in life, we always start with conservative treatment, typically consisting of anti-inflammatory medications, orthotics either custom or off the shelf, or physical therapy. Now, if these things fail to provide relief, occasionally surgery is necessary to provide a pain-free functional foot. If you're having problems with the flat foot and you'd like to discuss this further, you can make an appointment to see me in the Springfield or Alexandria offices. You can schedule online at orthovirginia.com. Thanks.